All right. Welcome, everyone. I'm going to go ahead and officially get us started today. Thank you so much for joining. We're so excited for this online book launch of our newest book at Hesperian Health Guides, Epilepsy and Seizures, Building Care in the Community. And we're really hoping that this event and this book can spark some great public discussion, build on and advance community action around epilepsy in countries all around the world, which I know our participants are representing. So we are excited to tell you more about the book and hear from some powerful change makers in epilepsy advocacy and clinical care. Our speakers today represent global regions, including Asia, Latin America, Africa, and so on. So I'm Amy Hill. I'm the editorial director at Hesperian Health Guides, and I'm your MC for today. And I've had the wonderful opportunity to work with Aditi Malhotra, Todd, the whole editorial team at Hesperian, and many, many partners around the world on this book. I want to thank everyone for being here again. We're gathered from different time zones, many countries today, because as you all know, epilepsy is global. And so therefore, so is the movement to build better community care for this very common, world's most common neurological condition. Before we jump into talking about the book, I want to just quickly thank our host partner, IBE, the International Bureau for Epilepsy. We have Donna here, who can maybe give a little wave. They are, as I'm sure many of you know, a nonprofit organization and a truly global network of 140 chapters in 100 plus countries, and they all work together to improve the social condition and quality of life for people with epilepsy. IBE has been such an incredible partner to Hesperian, connecting us with individuals, groups, networks around epilepsy advocacy and care that they've worked so carefully over the years to build in different regions. And then also thanks as well to CORE Group, a US-based nonprofit organization. They specialize in advancing and improving community health worldwide. We have Kate Kabor from CORE, and they've kindly provided us with this webinar platform to use. So we really appreciate their partnership and are glad to be a member and support their mission. So we are starting today's programming by hearing from the book's co-authors, Aditi Malhotra and Todd. They will introduce themselves and share an introduction to the book, and then we'll move into a speaker Q&A with our wonderful panelists, who you'll meet soon. And then after this hour-long program, we'll have a Q&A round for 15 minutes. So if you are able to stick around for that, we'd love to have you. But if you're not, that's the time when we'll indicate you can drop off. So we do have that Q&A box, which people have already found. So please go ahead and put your questions in the Q&A chat box, and we'll be tracking them throughout the conversation to respond during that Q&A session. So now I would like to introduce Aditi and Todd, and I'm turning it over to Aditi.
Awesome. Thank you so much, Amy, and thank you everyone who's gathered here. I am Aditi Malhotra, and I'm so fortunate to be among all of you in this global gathering. I am the co-author of Epilepsy and Seizures, Building Care in the Community, and I am a health education and human rights journalist and researcher. My subject matter expertise is in community health systems and advocacy, in gender-based violence, health stigma, and educational inequities. I was born and raised in India and have practiced my craft and skill and built community across the US since 2016. Today, I'm joining you from my home in Oakland, California. And again, such a pleasure to be here. Thank you again for joining. It's my absolute honor to now pass on the spotlight to Todd, my partner and co-author on this book project. Todd, take it away.
Thanks, Aditi, and welcome everyone. Thank you for devoting part of your day to joining us in this book launch. My name is Todd. I've been a writer and editor at Hesperian for many years. Aditi and I are co-authors of the book, which we hope will support people with epilepsy and correct a lot of the misinformation that is so common in beliefs about epilepsy and seizures. Could I have the cover slide, please? Great. You've heard the old saying, you can't tell a book by its cover. Well, with this book, you can. Epilepsy and Seizures tells you exactly what the book is about, and Building Care in the Community tells you how this book is different from most other books about epilepsy. The book focuses on community because that's where people with epilepsy live, not in clinics, but at home with families, in schools, at work, and at play. And that's where change is so important for the daily lives, the lived experience of people with epilepsy. Now, Aditi and I didn't come up with this insight about the importance of community on our own. We learned it from people with epilepsy, from their families and caregivers around the world. They're the real epilepsy experts. We've included their stories in the book. We put photos on the covers showing people doing what they told us improved their health and enriched their lives. And much of the time, these are things that people with epilepsy are discouraged from doing, from exercising in groups, for working for a living, using machinery, hiking or trekking in the wild, riding bicycles, swimming, fishing, and most important for many people, becoming a parent and building a family. It was important to us that the cover of the book, as well as its contents, make a positive statement against the stigma and discrimination that make life so difficult for people with epilepsy. Now, Aditi will introduce you to what's inside the covers of the book and how it got there. Thanks.
Thank you so much, Todd. And yeah, such a pleasure to have worked with you on this project for many years now. And here we are. I'd love to share more about what's inside the book, why and how it was developed and how it can be used. But first, it's my absolute privilege to introduce you to the work of the nonprofit publisher of this book, Hesperian Health Guides. For more than 50 years, Hesperian has provided information and educational tools to equip individuals and community organizations to take greater control over their health and lives, and more importantly, mobilize to eliminate the underlying causes of poor health. Our over 300 resources are available in 85 languages and actually in use in 221 countries and territories. All of them provide easy to understand, accurate, culturally respectful, intentionally illustrated, and thoroughly reviewed information on common health concerns for a variety of health conditions. You can find out more about the topics we cover on www.hesperian.org. Hesperian's materials, as you can see on this slide, are available as books through our unique Health Wiki online library that's on our website, through downloadable PDFs. And we've also developed 3 one-of-their-kind free multilingual mobile applications on reproductive health that I encourage all of you to check out. Now, why a book about epilepsy? Why did Hesperian delve into this? At the outset, it's important for me to say to you that this book is a health education tool. It directly addresses a global gap in simply written, reader-friendly health information about epilepsy and seizures. And while health education materials on epilepsy for a general audience do exist, and actually shout out to many of them that helped shape our research and contributed to our understanding of the topic, many of them respectfully fell short on one front. There is an unrealistic assumption about the resources people in different parts of the world have access to. This includes adequate medical care, education, but also things like safe neighborhoods, food security, social and emotional support at the community level, all of which contribute to a person's treatment plan, not just for epilepsy, but for several health conditions. Many resources are also in English, and there is a dearth of material in local languages that we'd all agree is what we use to communicate about our health, bodies, and mind. We wanted to develop popular education material on epilepsy that could speak to people with or without medical training, and more importantly, speak to folks about building a foundation and spirit of community care and education for epilepsy. Hence the title, Epilepsy and Seizures, Building Care in the Community. This book offers clear, accurate information about epilepsy. And sure, it covers its medical and physical activities, but more importantly, also shines light on the social, emotional, and psychological effects on individuals and communities. This is aligned, as many of us know, with the global movement and focus on community education to bridge the epilepsy treatment gap. A very brief note and a quick one about audience. The audience for this book includes people with epilepsy, their families, caregivers, health advocates or promoters, as they are known in many parts of the world, clinicians, teachers and students, policymakers, local administrators, faith healers, and really anyone who wants to seek out grounded, community-informed perspectives about care for epilepsy. This book is a guidebook, a manual prompting community action around epilepsy. It's also important for me to tell you briefly about how this book was developed, the process. Our groundwork, everyone, involved gathering and study of existing research and education materials of a variety. In the very early stages of content creation, we were already building close collaboration with epilepsy experts who represent our target audience from across the world. And then draft chapters went through rigorous internal editing and review by Hesperian's editorial team and staff before they were readied for external feedback and user testing. I'd love to hand over to my partner on this project, Amy Hill, who managed a lot of the community review and user testing process, to tell us a little bit more about who shaped this work.
Thanks so much, Aditi. I had the good fortune to join Hesperian just a couple of years ago, so I have not been involved since the start of the project, but I came in at just a wonderful time when I was able to support Aditi and really develop the partnerships with many of our reviewers. So as Aditi said, the book is truly the result of a collaborative model that solicited extensive review from a diverse network of grassroots organizations, partners, and so on. We had people living with epilepsy, their caregivers, community-based health advocates, clinicians, and so on, reviewing all of the chapters, fact-checking the medical content, sharing stories, and really helping to make the material more realistic and usable in various types of rural and urban settings. And a number of these partners are with us today as speakers who are making this type of grassroots work on epilepsy a reality where they live. So we are really pleased to be able to host this panel discussion. And I am turning it back to Aditi, who will kick off the panel.
Super. Thank you so much, Amy. And as Amy said, everyone, several of those partners are here with us on the screen as speakers today. And you will hear directly from them about how they see the book's capacity to spark public discussion and community action that can really, reduce stigma around epilepsy and strengthen care at the community level. They're making this type of grassroots work a reality where they live. So let's hear directly from them about what they do and how we can do it where we live. So first, it's my absolute privilege to join in conversation with Joe Wilmshurst. Joe, such a pleasure to have you here. Thank you so much for joining us. Everyone, Joe is a leading South African pediatric neurologist and professor. She is head of pediatric neurology and neurophysiology at Red Cross War Memorial Children's Hospital at the University of Cape Town, where she's joining us from today. Joe, when you first started collaborating on this project with us and getting to know the draft chapters and the team's approach, what did you see in the material that convinced you that the book can genuinely support people in different parts of the world and different points along the epilepsy care pathway?
Thank you, Aditi. And I have to say, I think I must start with a thank you for the opportunity of being part of this process. As any activity that happens, it's always important that you potentially learn more than it maybe comes out of it. And I think that I have also learned a lot. It's been a very humbling experience. And I think that there's often an assumption of perceived knowledge, and in the enthusiasm as clinicians of our talking to people with lived experience and caregivers, we don't always give voice enough to the person that's living with the experience, and to give that space and to listen to what is actually their perception, their understanding, and their barriers, rather than just a diagnosis of epilepsy and a control. So the book I found incredibly accessible. And what I loved was the illustrations of the situations that people have been in, the way it was relayed in such a relatable manner. And I would say in a relatable manner that really crossed regions and clinical settings and real world settings. And I hope that that follows through and can be used by people to actually help empower the voice that people have when they are dealing with either a diagnosis of epilepsy themselves or in somebody that they're responsible for the care of, such as a child. What I must also say is whoever does your illustrations is also brilliant. I love the illustrations. They're also really, really approachable as a lead-in. So really just to say thank you, and that I think this is going to be a really valuable resource in all regions of the world, and I hope becomes very openly accessible to as many people as possible.
Thank you so much, Joe, for sharing that, and also for being such a generous supporter of the project through its different stages, through development, when we're collecting contributions, when we're reaching out to you for review of the book. So many of you and your time and effort has made this possible. Before I turn on to the next speaker, who's also a really special person from Argentina or Latin America, I did want to put a face to the name of this book. So this is, ladies and gentlemen, Epilepsy and Seizures, Building Care in the Community. If you want to get your hands on the book, do a little touch, feel, and use of it. We'll tell you more about where you can get the book shortly. But now it's time for me to introduce Ivana Garcia and ask her a question about, her work and how she sees the book being used where she lives. So Ivana lives with epilepsy and is founder of Foundation Espacio Epilepsia, a digital platform that informs, connects, and supports people with epilepsy, their families, and their allies. Her work is in epilepsy advocacy across Latin America. Can we have the spotlight on Ivana too, alongside me? Yes, thank you, Ivana. Over several calls and through many interview questions with you, you have generously shared about your experience from growing up with epilepsy and not really knowing what it is, to now, for the last few years, successfully mobilizing so many people and founding a digital support platform for people with epilepsy from Latin America. I'd love to hear from you about what parts of your experience you are most excited to share with others through the book.
First of all, thank you for the book. I'm not sure if you can hear me well. Please let me know.
You sound great.
Okay, great.
Yeah.
So what I love the most about the book is that you put the spotlight in people with epilepsy stories, and most of all, people with epilepsy that have a story to tell. Epilepsy leaders, not only in Latin America, but across the world. So I think it's going to be a real inspirational book for anyone who wants to reduce stigma and inspire a lot of people.
Super. Thank you so much, Ivana. And so encouraged by all the work that you're doing on the ground in Latin America. Everyone, Ivana's story building Espacio Epilepsia and also her experiences during her childhood and teenage years, figuring out her epilepsy diagnosis is published in the book. So when you get a copy of that, you will be able to learn more about Ivana's journey and see how it applies to your current context. It's now time to hear a little bit from another part of the world. We're going to travel to India, where we'll meet Pooja Mehta Nandi. Pooja, such a pleasure to have you here. And I'd also like to give a huge shout out to her and her organization, Saman Association. We were actually able to do an in-person group review session in India in February last year with one of the chapters. how to help a person having a seizure, talks all about seizure first aid with Pooja and her amazing prowess at organizing groups and bringing people together. So just a formal introduction to Pooja. She is an epilepsy advocate and champion living with epilepsy. She is the treasurer of Samman Association, which is the Mumbai chapter of the Indian Epilepsy Association. Folks from India who are joining this call, please do check out Samman's work online and get in touch with Pooja. Pooja, my question to you is that you've been doing advocacy work in the world's most populous country, India. And India, as we all know, is home to a multitude of cultures. The vast diversity within the Indian subcontinent does mean that every person has such a different story. Ivana pointed out to this, but this book contains stories that people with lived experiences have contributed to, and you utilize storytelling as a key part of your approach in community organizing and, strengthening care around epilepsy. So can you share a little bit with our audience today about what makes stories so effective in the support group oriented work that you do?
Hi, everybody. I am Pooja Nandi, and I am joining you today from Mumbai, India. Thanks for the question, Aditi, and thank you very, very much to Team Hesperian, to IBE and the CORE Group for having me here. Congratulations to Aditi and Amy and the entire team at Todd and the entire team at Hesperian for the book. I think Samman is really, really grateful to be a part of this book and, partner with you in whatever way we could in the creation of this wonderful book that you have created. So Samman is basically the Mumbai chapter of the Indian Epilepsy Association and has been working in the space of epilepsy awareness and epilepsy care for the last 50 years. Before I go into the entire universality and the diversity of India, I just want to start by drawing your attention, Aditi, and the entire team on the recently published GENS study. So the GENS study is the Global Epilepsy Needs Study, which was recently published by the IBE. And it's a first of its kind global study that speaks about the psychological and daily challenges experienced by people with epilepsy. So this is the first study that studies the emotions of people with epilepsy and talks about how the quality of life can be improved for persons living with epilepsy. So the findings of this study show that there is a universality in how people with epilepsy experience social exclusion across. And what's amazing is it doesn't matter what strata of society, what culture, what country do you come from, does an individual come from. The experience is irrespective of the country or the economic strata. 54% of the people surveyed as part of the GEN study have said that my local community needs better information to get rid of old incorrect beliefs about epilepsy. So this kind of resonates with so many of us. And I think this is one of the main problems or issues that the book solves. There's information, there's correct information just available at the click of a button online. We just have to log on to Hesperian. The other thing is that I love stories and I use storytelling as a huge medium in all my support groups. And the kind of examples that you have used, Aditi, for communicating in this book, these are stories and examples I would keep going back to and keep talking about them. Like, this is just the human side of epilepsy. And this is going to bring out everything that I stand for, because one can lead a good life with epilepsy. And that is what Hesperian is talking about. Just the right kind of care, the right kind of information, and we can lead a good life. So yes, the human to human connection that gets built with storytelling is amazing. And I think you guys have done this job beautifully. So a huge congratulations on that. And I am so excited, and I will keep coming back to this book just for the stories and the illustrations. And it's amazing. Thank you once again for doing this. And thank you for partnering with someone to do this. Thank you.
Oh, thank you so much, Pooja. And your energy and enthusiasm in this work is inimitable and infectious, and makes so much possible, in the epilepsy advocacy world in India, which is a really challenging place to, draw unity and harmony towards such a cause together. So congratulations right back at you. Um, and I do want to say that Pooja pointed to some of the stories, and in the book, there's also a story about how Saman Association actually built a really amazing community education campaign and program for government schools in Mumbai, India, through the local administration system. So again, please read into the book, get your hands on a copy of it to get into the details a little bit, into the juice of these stories. We do want to show you some pages from the book at this point, and I am going to hand this back over to Amy as I share screen. Amy, back to you, and I'll pull up the slides for this next little promo pause that we're going to transition into.
Wonderful. And it's just so fun to hear from people who we connected with a couple of years ago, really, and have worked alongside for so much time. It's one of the first times I've heard you speaking directly about your enthusiasm for the book. So it's really just very moving. So in the spirit of taking a sneak peek at some of the content, we wanted to look at a couple of examples, and I think Aditi is bringing up some slides. So the first two examples that we have on the screen here are from our chapter on living well with epilepsy. So we hear from, I'll give a big shout out to Bright Walia in Zambia. I don't know if he's on the call today, but has really been so generous in sharing a sweet story about his love for cooking. And you'll see that in the book, you'll see that the story is presented alongside some really practical and useful information about how dietary changes can help with seizure control and tips for staying safe with cooking. Also, another big thanks to Vinay Jani in India, who I'm not sure if you're with us, Vinay, but he shared a really inspiring story about the role that cycling has played in his efforts to manage his epilepsy. So this entire chapter on living well with epilepsy really covers the importance of physical activity, the importance of eating well, and also a lot of good content around sleep, all as ways to help with seizure control. And then on the next slide, we have an example of a story that addresses stigma. So as Pooja was mentioning, and thank you so much for bringing up the GEN study. That's just such a superb piece of work from IBE that was really a labor that I know also spanned a number of years. So it's an incredible piece of work. And we love how it sort of dovetailed with the final stages of this book, because we've been able to kind of bring in some of the pieces that were addressed in that study. So in terms of stigma, the issue of epilepsy stigma is really woven across the entire book, but we do have an entire chapter on epilepsy stigma. And this is just one of the number of stories from that chapter, which focuses on a really wonderful campaign that was run in Hong Kong to change a very stigmatizing word that was used to refer to epilepsy. And there are many other examples in the book that we're excited for you to see. So on that note, let's just take a quick look about how you can get a hold of the book. You can order it online from our Hesperian store. The information is on the slide, and certainly we'll share it out afterwards. You can refer to the, and we don't have the information. I think there's, I'm just looking at the slide. Right. So soon you will be able to find it on Hesperian's Health Wiki, which Aditi mentioned earlier in our session, which is just a wonderful searchable repository of accurate health information that includes the contents of all of our print books and more. So that's a little preview of some of the things in the book. And now we're going to continue on with our panel.
Superb. Thank you so much, Amy. And just to let the screen be a little bit on for longer, the QR code that you see, actually, if you scan it real quick, you'll be led to Hesperian's online bookstore. We will also have the book up available on Amazon shortly. We'll keep you posted about that. Stay tuned for all our updates by signing up to Hesperian's newsletter. That's where we send weekly communications to our network and community. And I'd love for you to keep yourself posted on different ways to get this book. And more importantly, to use it, like I said, where you live. Carrying on now with the second set of speakers, getting more into hearing from folks who've been so instrumental in shaping this work. I'm going to turn now to Anita Mago, who's joining us from Uganda. Anita, welcome to today's launch, and big thank you also for all the work that you have done together in collaboration with us. Anita is a social scientist and an advocate for caregivers of epilepsy and for epilepsy awareness overall. She really is like a shining light and a bright spark in the caregiving advocacy space. She directs programs and awareness campaigns at Purple Bench Initiative, an organization in Uganda that focuses on reducing stigma and improving support for people with epilepsy. It hasn't been mentioned on this call just yet, so I just want to take a brief minute to say purple is actually the color of epilepsy awareness, which is why you see that we're all like bathing in purple a little bit today. So hold on to that sentiment, and Anita's organization is also named after that symbol, highlights that symbolism. So, Anita, my question to you is that you've played such an important role in ensuring that the material is widely applicable. But we know that taking and adapting this material is important to fully serve the local context. You got a little taste of it when you were reviewing draft chapters with groups where you live. Based on your experience through those review sessions, Anita, what suggestions do you have for how others can adapt the materials in their community?
Thank you for having me on this panel and your question, Aditi. I believe that the core of all this work involves the value of beginning with listening. This is very important for me personally, and also in the advocacy work I do at the Purple Bench Initiative here in Uganda, especially towards stigma reduction. Listening allows us to understand what people are saying about epilepsy. It gives us a peek into what they believe and what we do. Then we get to honor the act of listening by responding with what we know about epilepsy. It's the same spirit of listening that has shaped this book that we are launching tonight. From its development to our review process, where the authors and editors really wanted to hear from our experiences. They listened to us, listened to the extensive feedback we have shared on the draft chapters and sections in the book too. The book has such simple language. There are illustrations and real-life examples. These elements will make it easy to adapt locally, whether it's with community groups or even with family and even in neighborhood discussions. So for that reason, I would encourage everyone to start with the book. Try out one chapter or activity, see how it feels and how it fits, and share feedback with Hesperian editors if you feel there's need for that. They will definitely help you to refine and adjust material as you adapt it for your own community, while, most importantly, keeping the core information accurate.
Amazing. Thank you so much for sharing that, Anita. And you articulated that so well, right? The nudge here is to just pick up the book and try like a small section of it where you live, and see how it works. And Anita is absolutely right. We're here at Hesperian to continuously work on improving this book. So this is just the beginning, and the more you use it, the more inquisitive we will remain about what's working and what's not. We followed that through in the community review and the user testing process of this book. So keep it coming, as you use the book and adapt it to your local contexts. Thank you though for that, Anita, and also big shout out to Purple Bench Initiative again. Their story, Anita and Nina Mago, her daughter, who lives with epilepsy, is also published in chapter 2, how to help a person having a seizure. They have very amazingly organized community seizure first aid trainings where they live. And have aspirations for Uganda to be an epilepsy smart country. So more power to that, and more power to continued work like this all across the world. My next friend and speaker is Mauricio Olave. So we're taking you from Africa back to Latin America for a little bit. We heard from Ivana Garcia a little bit ago, and now we're going to hear from Mauricio, who's joining us from Colombia. Mauricio, everyone, is a speech and language specialist from Colombia who works at Fundación Centro Colombiano de Epilepsia y Enfermedades Neurológicas, FIRE, in Cartagena. Mauricio, please feel free to improve the pronunciations of the Spanish language title of your organization. His work and passion is in epilepsy education and advocacy. Mauricio collaborated with epilepsy organizations and individuals from several different Latin American countries to organize group review for a selection of our draft chapters. Just an amazing powerhouse for epilepsy advocacy in Latin America, Mauricio. My question to you is, thinking about, all the people who participated in your groups, really curious to hear, what did the process mean for them? And when you were sort of sitting in the midst of these discussions, did you see ideas about epilepsy shifting or sparks being created? How did you see it impacting the people who were in that room reading the chapter and discussing different topics?
Okay, thank you, Aditi, and welcome everyone. Before I answer the question, I would like to congratulate Hesperian Health guys, IBE and CORE Group, for making this happen. You have made an amazing work. Thank you to Todd, Amy, and Aditi, and it's a real pleasure being with you. Well, I have to say that IBE, Latin American chapter, have been working so hard from many years with high commitment for people with epilepsy. We have been working for rights, education, a real inclusion at all levels, and we want to raise the voice of people with epilepsy, reducing stigma and discrimination. We are convinced that this book is a powerful tool to increase quality life of people with epilepsy, and also is going to help those people who works or live around epilepsy. For this reason, I think, or maybe we are convinced, that all the participants were so excited and happy to be part of this project. I would like to highlight two things. First of all, is that the review groups involve groups from Colombia, Salvador, Ecuador, Argentina, and Paraguay. This allows us to share experience, to share knowledge, and to learn from each other. Also, let us understand our capacities and needs around epilepsy. Also, it's so important to say that this is not a normal book. This is a guide done with love and commitment from so many people from different profiles, sharing experience and knowledge. We had heard from people with epilepsy, medical personnel, nurses, psychologists, speech and language pathologists, social workers, neurologists, neurosurgeons, sport trainers, teachers, family of people with epilepsy, and caregivers. All the contributions that we received were so important to make this happen. And the last thing I have to say that when we review chapter 5, acting on stigma in epilepsy, we conclude, unfortunately, that stigma discrimination is still present in our region and it's worse than the seizures. So we have to keep working on this. We had the opportunity to share strategies implemented. For Colombia, I had the opportunity to talk about the 1414 Colombian Protecting Epilepsy Law, for example, that here in Colombia is very useful to help people with epilepsy against stigma and discrimination. I think that we have an important message is that we have to work together and do not let that epilepsy stop you. That's my point of view, and I'm so happy of participating of this amazing project. Thank you very much.
Thank you, Mauricio, and everyone from Latin America and from Mauricio's group who is on this call and this webinar today. You have all been so amazing and so instrumental in shaping the way the details and the nuances of the material in this book look like. Mauricio gave a shout out to chapter 5, acting against stigma. And then before I move on to the next segment where we will have two of our contributors, reviewers, and advisors in conversation with each other, I just wanted to take like a brief moment to walk us all through the table of contents for this book. Perhaps there's a title for a chapter in there that really resonates with your work, and I want to make sure that we're communicating that to you. So there's a chapter, like I said, chapter 2 on how to help a person having a seizure. All that good information about seizure first aid, not just the type of things that we read online with the 5 points, but the different things that happen during a seizure, different possibilities, what to do after a seizure passes, and of course, some great stories from Uganda and another part of the world around organizing community seizure first aid trainings. Chapter 3 is on types of seizures and how to identify them. The next chapter, number 4, is on medicines for epilepsy and seizures. The 5th chapter, one of the most engaging ones on acting against epilepsy stigma, full of activities, things you can use in the moment where you live. Chapter 6, Living Well with Epilepsy. Many of our reviewers have said that this is their favorite chapter out of them all. It talks about physical activity, good food and nutrition, the correlations between sleep and seizures. So an important chapter and actually takes up a lot of breadth in this book. Pregnancy and birth with epilepsy, a topic we cannot ignore. We talk about that in chapter 7. Chapter 8 has information about how to talk to children about epilepsy and seizures, age-appropriate guides, the kind that you want in one place so that you can pick it up and use it in your support groups. And the 9th chapter is on preventing violence and how that can actually help prevent epilepsy and seizures. A little bit of concept development around structural violence and its links to epilepsy and seizures. And we're hoping with the information in this chapter, more discussion can spark around the connections between violence, both physical and structural, as well as epilepsy and seizures. So with that in tow, I'd now like to introduce our next two speakers, Tolu Olaniyan and Eddie Chengo. Tolu and Eddie, such a pleasure to have both of you with us here today, and also so excited that you're both on the same screen. Everyone, Tolu is a learning disability nurse with several years of experience, and she's currently practicing in the UK. She specializes in assessment and provision of holistic care for people with epilepsy and runs a powerhouse of an organization called Protola Global Health and Consulting that organizes annual epilepsy trainings for clinicians from Africa and beyond. For this next segment, Tolu will be in conversation with Eddie Chengo. Eddie, welcome. Eddie is a Kenyan epileptologist, clinician, researcher, and advocate for improving epilepsy care and awareness, especially at the grassroots level and in remote parts of the world. Eddie has been our medical reviewer on this book, and we'll hear from Eddie himself about how his experience interacting with the material was in his medical review. He read the entire manuscript in full before the book came out into publication. Grateful for your time, and Tolu and Eddie, take it away.
Okay, thank you everyone, and it's good to connect with you all today. So as you mentioned, myself and Dr. Eddie Chengo were involved in reviews of, I was involved in several chapters of it, and of course Dr. Eddie was really involved in reading the whole thing. But I'd like to come to you now, Dr. Chengo, about the content from the clinical perspective. You know, as clinicians that we are, the content of the book, how have you found it, you know, through your review? What did you find?
Yeah, thank you. Thank you very much, Tolu, and thank you everyone for giving me this opportunity. And first, I'd like to say that epilepsy care, rather epilepsy goes beyond diagnosis. It basically requires precision to decision making, because every step we take as clinicians will impact on the patient's life, and it's a responsibility of us as clinicians to ensure that we classify seizures correctly so that we have the correct diagnosis of it. And our role is basically to reduce the seizure in terms of treatment, but more importantly, improve the quality of life by ensuring that the medicine that we give to the people with epilepsy have fewer side effects or no side effects at all. So that's very important. And therefore, the approach is basically careful selection of anti-seizure medication with appropriate dosing and continued follow-up of these patients. And special consideration also has to be there, especially for groups, for example, the drug-resistant groups, the people with comorbid mental health condition, but more importantly, those with women in childbearing age. That's a very important group also to take care of. And this book provides that structured and practical approach into addressing all these issues that I've mentioned. It offers a clear guidance, a practical use of anti-seizure medication, dosing consideration of all commonly used anti-seizure medication. But of course, it's important to understand that there's a caveat when it comes to dosing in different countries, and clinicians have to be careful and probably go through their local guidelines as well. I think it's important also to mention that, but of course, there's good consideration when it comes to dosing in the whole book. So critical areas, again, you find that they were clearly stipulated in the book when it comes to pregnancy and epilepsy, and the community as well, how the book can be used. It really stands out when it comes to its simplicity. It's very simple, easy to use book. It's accurate and easy to apply at the community, and therefore a good and practical guide and supports better patient care. And I'd like to say that this book is highly relevant in low and middle income countries. That's very important. And therefore, I would urge people to read it and use it to let it enhance care. Yeah.
Thank you. Thank you, Dr. Chengo. And based on the work we do in low resource countries, currently right now we're in Botswana on a project here in Botswana, and the knowledge gap that's been, we've identified through the work we do in different countries. It's important that we provide resources. People have access to resources that can help increase their knowledge and expertise around a condition like epilepsy. So this resource can help as well. Thank you. Sure. Aditi, take it away.
Thank you so much, Eddie and Tolu. And again, a shout out to all the hustle that you two do to make, this strengthened clinical care and advocacy around epilepsy a reality in some challenging settings. Tolu is just such a powerhouse with all the work that she does by organizing these annual trainings. Please follow her organization's LinkedIn page where she posts more about the work that they're doing. And Eddie, always and eternally grateful for all your time and support on this project. It's been really amazing. And it's given it that, extra polish, given that there's so much medical content in the book, to make it relevant and accurate for wider audiences. Thank you both again. With that, we are closing in on the speaker Q&A section. I do want to shine a spotlight on one of our speakers who could not make it to today's programming. Bindu Menon is a neurologist from India, and she runs a superb grassroots community care programming in India, in the southern Indian state of Andhra Pradesh, called Neurology on Wheels. The work of Neurology on Wheels, where Bindu takes clinical care and epilepsy education to different villages in her state of Andhra Pradesh, that story is also featured in our book. And Bindu actually kindly wrote a short note and sent it to me on WhatsApp. So I'll just read it out aloud, or at least sections of it. Bindu says, it's been a pleasure to be associated with this project since Aditi and I connected at the ILAE Asia Oceania Conference in New Delhi in 2024. And I'm especially happy that our initiative, Neurology on Wheels from Nellore, India, has been featured. At Neurology on Wheels, our guiding motto is we reach, we teach, we treat. And education forms the backbone of everything that we do at the grassroots level. She writes that in India, primary healthcare delivery is closely integrated with maternal and child health services. Many of us are familiar with the ASHA program, and that plays a crucial role in community outreach. She is truly excited, she says, about the potential of this book being adapted and used across multiple layers of health education, not just in her state, but across India and even globally. A little note for how Bindu saw this work helping primary care clinicians. She says for primary care clinicians and community health workers with limited medical literacy, especially those engaged in the door-to-door kind of care that she engages with when she's doing her work with Neurology on Wheels, this book simplifies complex topics such as recognizing seizures, understanding the importance of adherence to daily anti-seizure medicines, and addressing stigma associated with epilepsy. I'll pause there, but do connect with Bindu again on LinkedIn. She is on the platform, and also check out her work online. Neurology on Wheels is her program and her foundation. And with that, we're actually coming to a close of the speaker Q&A section. Time for me to hand it back to Amy, but just want to thank all of you, Anita, Joe, Mauricio, Ivana, Tolu, Eddie, Pooja, Bindu, who's not here with us right now, but you're all so amazing, and we are so lucky to have your support. Thank you so much again. And Amy, back to you.
Thank you, Aditi. And again, just double thanks to our host partners, panelists, and everyone who has attended today. Everybody's contributions have really helped extend this book's collaborative spirit. And again, it's really meant to be adapted for use by people with epilepsy, family members, caregivers, advocates, and so on. So we really, really encourage you and hope you'll share information about it through your networks. And we will be sending out a follow-up mail with a link to the recording of this event, key links, and ways to stay involved. And I wanted to close us out with just, I posted it in the chat, but in case people didn't see it, we received just last night a wonderful message from Action Amos with IBE Africa, who was closely involved in the development of their excellent guide on addressing epilepsy stigma. And they very generously gave us permission to adapt that definition for use in our book. And so this is the quote from Action. He said, "In our communities, no one is meant to walk alone, and no one should be left behind because of epilepsy. Some books remain like bridge designs on paper, but this one helps people cross the river. It equips families and caregivers to turn silence into understanding, stigma into dignity, and care into shared responsibility. So big appreciations to Action for all of his wonderful work, and to IBE. So this does mark the end of our official programming for the event, and we are now turning to a Q&A round. So as you have seen, there is a Q&A button there down at the bottom of your screen, and panelists, co-authors, and hosts are here to take your questions. So for anyone who wishes to drop off at this point, we really thank you for joining. We'll be in touch. And I am, let's see, Aditi, do you want to bring up the first question?
Yes, absolutely. The first question actually that I'm seeing is from Vinay Jani. Vinay, thank you so much for joining the program today. So good to see you. I'm going to unmute you so you can say hello and ask your question yourself.
Hi, Aditi. Thank you so much. So I want to know the use and adaptation of the health guide.
That's a great question. Todd, would you like to share some about that? Vinay's question is, how to use and adapt the health guide, and he's joining us from New Delhi, India.
Sure. Vinay, I also want to say, Vinay, your story about bicycling, which we include in the book, is incredibly inspirational. And I've actually already used that with a friend who said, but, you know, how can people with epilepsy ride bicycles out in the world and do it safely? That's your story shows the kind of actions that are needed, not just by you, but by us to make the world safe for people with epilepsy. And actually, that also means safer for everybody else who gets on a bicycle, as I do regularly. And I think it sort of points to an answer to your question. The book is really helpful in the sense that none of us know everything about epilepsy. None of us know always what to do or how to explain things in a way that makes sense to ourselves, our families, and other people who are either learning about epilepsy for the first time, coming across, making friends with people who have seizures, and figuring out how to respond to that. So I think, you know, how to use the book is to read it. And it's freely, or it will be freely available online, as well as we certainly encourage you to buy copies. That's one way. Another way to use it is to say, well, this story is really good for people who live in India, but how do I use it in, you know, Colombia? And the idea for that is just take the general idea and transform it into something that discusses your reality and use it that way. A lot of people, I will say, we are very happy to see when they cut out a picture or photocopy a picture and put it on their flyers or educational materials. There's lots of ways to use the book, both as personal education, as community education, and to do your other health work or organizing work that involves health issues. Thanks for the question, Vinay.
Thank you so much, Todd. And thanks, Vinay, for asking that question. Everyone follow Vinay on Instagram. Vinay is very active in actually sharing his thoughts and the work that he's doing, not just cycling. He's also like running marathons and whatnot. Recently in a conversation on a podcast about that. So give him a follow if you're on Instagram. And if you're in India or elsewhere, get connected, y'all. That's sort of like the momentum that we want to be, you know, moving forward with. So thank you, Vinay, for your question. I also am seeing a couple of questions. Lenny and Tesfaye are both asking about translations for other languages. This has been a question on the mind of many of our partners and reviewers. And to actually answer that, I'm going to turn it back to Todd as well as Amy to chime in on translations. Over to the both of you, Amy and Todd.
Well, I'll just start by saying Hesperian produces all of our books in English and in Spanish, and we help people produce the translations in other languages. We will also aid people in issues around design and whatever might be necessary, but really we depend on you to do the translating. And we do not charge anything or hold a copyright that prevents you from doing that. We have an open copyright policy so that whether you just want to translate, a couple of activities into a guide for, doing work locally, or a chapter that you think is particularly useful, or the entire book, let us know what you're doing. We'll let you know if anyone else working in your language has contacted us as well, so you could work together. And we'll do what we can to support the translation. Amy, what else should we say about this?
I think that just about covers it. I think what would be really useful will be, as part of our follow-up, we'll send some specific information about how our translation process typically works. And just to mention that we do have an existing really, really extensive network of translators in various countries and languages. So of course, we'll be tapping in to see if we can, if they'll be able and interested to work with translation. And then just to reiterate Todd's point that, the book is not super long. It's very accessible. We love the size of it, but it is still an entire book. So it may be that in your context, there are 1 or 2 chapters which are especially interesting that you think will be really, really useful. And so it's certainly possible to focus in and just translate those specific chapters which you feel you will use most. So as we have, as we're gearing up to do distribution and sharing of the book globally, this is definitely our next priority, is making sure that we can help get the material into as many languages as possible.
Thanks, Todd and Amy. Yes, I'll just add to that to say, get in touch if you're interested in doing a piece of translation work for your local language. Epilepsy@hesperian.org is where you can write to us. You can also write directly to Amy, Todd, or I with our names at hesperian.org. And all of this information will be landing in your inbox in a follow-up email, so stay tuned for that. I'm not seeing any more questions, but I did want to read out aloud some messages that I'm seeing on chat, and also shout out to some of the people who are writing this in. Jessie from Zambia, who's been a reviewer. Hi, Jessie. Jessie says it was an honor and privilege to participate in the chapter reviews. Oh my God, an honor and privilege to have you on board, Jessie. Thank you so much for all the organizing work that you did. Donna Walsh is also here with us. Donna is CEO of International Bureau for Epilepsy. Donna, would you like to share a few words with the audience right now?
Thanks, Aditi, and hi, everybody. I wasn't planning on saying anything. It's just been a real privilege to sit and listen to all those who have been hugely actively involved. But I think for me, the message that I put in the chat was just to recognize all of our chapters who are our member organizations around the world, the advocates who partner with us, who we approach to be part of this process, and who have been so generous with their time, with their expertise to really bring this book to life. So I really just wanted to say also on our behalf, a big thank you to all of those organizations and advocates who've been part of this. And hopefully they will see the value in using this resource in their work on the ground, which I have no doubt about it, given the contributions we've heard today. And obviously also to Hesperian for taking up the mantle on epilepsy and actually developing this guidebook. So thank you to everyone is really all I'd like to say at this point. Very happy to have been here today and to eventually see the book be published. And I was delighted to see the hard copy, Aditi, that you actually had in your hand. So thank you to everyone.
Thank you so much, Donna. Such a pleasure to have you here. And here it is one more time, another look at epilepsy and seizures, building care in the community. Hard copy in my hands. Get your copy today too. And also shout out to Ellie, Niam, Claire, Marie, and others at IBE, Donna's incredible team who've been so supportive and so incredibly available and generous with their time. Like that always blows my mind to, like help us through this process. We truly are powering this, the spirit of community care with communities. So really grateful for all of you, Donna. I'm going to read out aloud a couple more. I'm not seeing any more questions. We have just a few more minutes. If folks have questions, please pop them into the Q&A chat. Danny Behonik, who's actually our medicines editor and an updates manager here at Hesperian, has a message. Also, Danny, I'm going to unmute you so you can share a little note with our audience too.
Hi. It's so nice to be here with you all. I'm having such a fantastic time. I just made a note in the chat because I'm a former classroom teacher and I had students who had a number of seizures in my classroom over the years. And so working on this book has been amazing in the sense of how many times I found myself wishing that I'd had this book when I was a teacher, because I was really lacking the information I needed to support my students, despite my best efforts. So thank you from past me, who really wished that this book was in their hands at the time.
Thank you, Danny. That's a really critical part of our target audience, teachers and students. Hearing from you is a real endorsement to the use of the book in the classroom setting. And Pooja also may have some resonance with that, with all the work that Saman did with schools in Mumbai around training teachers and actually seeing tangible results in stigma reduction. So yeah, just wanted to give a shout out to that piece and slice of our target audience, teachers and students. But in any case, for any questions around adaptation, distribution, as well as translation, please do write to us at epilepsy@hesperian.org. We will be looking for your thoughts and your sort of ideas on how to take this forward. And Nicholas, thank you for joining us today. This launch has been so powerful and so engaging that time has just flown by, at least for me. And with that, I do want to pass it back to Amy to help us wrap up the programming. Thank you so much.
Sure thing. Thanks again, everyone. Wonderful to have seen you all and heard from you, and just wanting to especially thank Aditi for wrangling this group and organizing this event so beautifully. So thanks on behalf of our team. Thank you to our host partners at IBE and CORE Group, and to everyone who has tuned in or is tuning in at a later time. If you're watching the recording, please by all means reach out to us at epilepsy@hesperian.org with your questions, with thoughts, with ideas for adaptation. And we really, really hope that you will stay in conversation beyond the webinar. Thanks so much.